Hello everybody. We apologize for a little bit delay. Good afternoon and a warm welcome to all for today's online lecture session. I am Srinu Apikonda, curator at Birla Industrial and Technological Museum. We thank all of you for joining us today. Antimicrobial resistance is a global health and development threat. World Health Organization has declared that antimicrobial resistance is one of the top 10 global public health threats facing humankind. We are happy to have a lecture. We are happy to have a lecture today on the same topic, antimicrobial resistance and superbugs on World AIDS Day. We are delighted to have Dr. Sanjay Bhattacharya here with us today as a guest speaker for these sessions. During the sessions, viewers may post topic-related questions for the speaker in the comment section. A few of them will be answered toward the end of the sessions. We have with us our director, Sri V.S. Ramchandran. With this note, may I now request our director, Sri V.S. Ramchandran, to introduce Dr. Sanjay Bhattacharya, the speaker for this afternoon. Sir, please.
Hello viewers. All of you are aware that today is World AIDS Day, December 1. We have got a very apt topic and a very prominent speaker on this occasion. The topic is antimicrobial resistance and superbugs. And Dr. Sanjay Bhattacharya is available with us. I would like to give a brief introduction and then there is a platform for Dr. Bhattacharya. Today, we shall learn from Dr. Bhattacharya the problems of antimicrobial resistance and superbugs. Dr. Sanjay Bhattacharya is the chairperson of Hospital Infection Control Committee, Tata Medical Center, Kolkata. He obtained MBBS from North Bengal Medical College, West Bengal MD in Microbiology from JIPMER, Pondicherry. He obtained DNB from the National Board of Examinations, New Delhi. He also obtained DIP FRCPath in Medical Microbiology and FRCPath in Virology from the Royal College of Pathologists, London, UK. In addition to this, he was involved in various WHO projects, World Health Organization, like Working Group for Priority Pathogen List, Working Group on Environmental Cleaning in Carbo-resistant organisms, Working Group Landscape of Diagnostic against Antibacterial Resistance in LMIC. He was also involved in ICMR, Working Groups on Bacteriology. Such an eminent speaker, he has got more than 100 articles under his name. So, welcome you, sir, on behalf of Birla Industrial and Technological Museum. That platform is yours. Please go ahead, sir.
Thank you, sir, for the very kind introduction. And I would like to thank the Birla Industrial Technological Museum, the director, sir, and the curator, sir, for giving us this wonderful opportunity to speak to our audience about the problem of antimicrobial resistance and the superbugs. So if I could have the first slide, please. Yes, Srinu, sir, it would help me.
Yes.
So if you could share the slides.
Yes, I'm presenting. Sir, could you see the slide? Is it visible?
Yeah,
sir?
if you could make it full.
Yes,
yeah, it is visible, but
once it is confirmed, then I'm making yes. Yes.
Yes.
Yes, sir.
Thank you. Okay, so I begin my presentation with the topic superbugs and the global problem of antimicrobial resistance, also known as AMR. And I would like to thank the National Council of Science Museum and the BITM, the Birla Industrial and Technological Museum, Kolkata, which has been a very fond destination for me and my children for the last many, many years. And I'm very fortunate and honored to be part of this initiative from BITM. Next slide, please. So as you know that antibiotics are used for a wide variety of infections. And these antibiotics are actually life-saving drugs. Now, these drugs actually are very important for the health and well-being of patients who are suffering from infections, particularly bacterial infections. Now, what happens? This slide shows you what is the burden of antimicrobial resistance infections in India, and it is an example of how these infections are responsible for the death of many, many people. And in this case, it shows the burden of antimicrobial resistance in India neonates. Now, neonates are children who are actually less than 1 month of age, so less than 30 days of age. So this slide shows that every year, 1 million Indian children die in the first 4 weeks of life. So that is called the neonatal period. That is the first 4 weeks of life. 1 million or 10 lakh Indian children do die, unfortunately. Of these, about 2 lakhs, so about 20% of them are caused by sepsis. So sepsis is a serious form of infection. There are many causes of sepsis. Most common causes are bacterial sepsis, and they kill about 2 lakh people, or 1,90,000 children who are neonates every year. Now, it has been seen that about 60% or just over 30% of the neonates, 100 a day, it's about 150 a day. Neonates die every year from antibiotic resistant infections. So that's the scale of the problem that we are facing. It's not a problem restricted to India only. It's a global problem. Countries do have variety of different types of infections and variety of rates of drug-resistant infections. And this shows how these infections actually damage our society and our well-being. Next slide, please. Next slide, please. Yeah. So first of all, we need to know what are the common superbugs. Okay, and but before that, we would actually try to understand, if you go on to the slide after that, what are superbugs. Now, Mr. Srinu, the next slide, please, because I think there is a sequence problem with the slides. So if you could go to the next slide, please. What are superbugs we need to actually understand? So superbugs are actually extensively drug-resistant bacteria. Sometimes the term could be applied for extensively drug-resistant fungus, which fail to respond to common and broad-spectrum antimicrobial agents, which could be either antibiotics or antifungal agents. So these are extremely drug-resistant bacteria, or they are extensively drug-resistant fungus, which fail to respond to common antibiotics or antifungal agents. These bugs, these are germs, bacteria or fungus, very small in size, can spread from one person to another. And they can cause serious life-threatening infections, mostly in hospitalized patients. These can lead to high rate of morbidity, and these morbidity can manifest as healthcare associated infection. Morbidity in simple term is sickness. It can lead to high mortality or deaths. It can lead to increased hospitalization, or it can lead to increased healthcare expenditure. So if we are to measure the impact of the superbug infections, we have to actually look at morbidity rate, mortality rate, hospitalization rate, and healthcare expenditure rate. So if we would now go on to the previous slide, Previous slide, please, sir. Yeah, so these are the common superbugs. Now, these names are very familiar to microbiologists, but I'm aware of the fact that majority of the people in the audience may not be microbiologists. So you don't need to remember the names if you are not a microbiologist, but these are the names if you're interested in scientific nomenclature, then these are the names actually you can consider to remember. So the common superbugs, or which are extensively bacteria, or they could be fungi. If they are bacteria, then there are a few types of them. 6 of them are very common. These are methicillin-resistant Staphylococcus aureus, vancomycin-resistant Enterococcus, carbapenem-resistant E. coli or Escherichia coli. Carbapenem is the name of an antibiotic, a very broad spectrum antibiotic used for the treatment of serious bacterial infections. Carbapenem-resistant Klebsiella pneumoniae and carbapenem-resistant Acinetobacter baumannii, as well as carbapenem-resistant Pseudomonas aeruginosa. Now, among the fungi, you have Candida auris, which is a extensively drug-resistant fungus and which can also be classified as a superbug. There may be a few others which I have not actually included in this list, but please be aware that these are the common ones of common types of superbugs that are usually encountered in India as well as in other countries globally. The numbers may vary from country to country, but they are generally present in most countries of the world. Next slide, please. Next slide, please. Yeah. So, what are the common antimicrobial agents against which superbugs are resistant? Because we are talking about antimicrobial resistant infections, it is worthwhile actually to know that there are infections which do not respond to antibiotics. And we need to know what are these antibiotics to which the superbugs don't respond. So these are many of them are very, very common antibiotics. So for example, there are antibiotics like penicillin, cephalosporin, aztreonam, which are not effective against most of the superbugs that we have actually discussed. There are antibiotics like beta-lactam, beta-lactamase inhibitor. These are pharmacological names, these are chemical names, but it would make more sense to a microbiologist or a pharmacologist or a doctor. But it is also important for anybody interested in science to be aware of their existence. Carbapenem group of antibiotics like meropenem, imipenem, doripenem, ertapenem, and there are other common antibiotics which are given antibiotics comprise about maybe 90% of the common antibiotics that are used in clinical practice, in medical practice. So the superbugs do not respond to most of them, and that makes them super. So they are not just bugs which cause infections, but they are bugs which do not respond to antibiotic treatment. So that's why they are superbugs. And antibiotic or antifungal resistant superbugs, which are drug-resistant fungi like Candida auris, they don't respond to things like fluconazole, voriconazole, amphotericin B, which are name of some of the common antifungal agents that are used in clinical practice. So to sum up, they are very, very difficult organisms actually to treat in whatever setting it could be. Next slide, please. Now, we need to also know what are the common infections caused by superbugs. Now, so the superbug is not those pathogens which are causing only one type of infection. So this list shows you that a variety of different type of infections are possible due to superbugs. And these could be bloodstream infections, also known as bacteremia or fungemia, if it is caused by bacteria and fungus respectively, urinary tract infections, healthcare associated pneumonia, ventilator-associated pneumonia in patients who are ventilated for a variety of reasons because of respiratory failure, surgical site infections, medical device-associated infections like IV catheters, urinary catheter-related infections, skin and soft tissue infections, as for example, those due to bed sores or pressure sores or diabetic foot, etc., and sepsis and septic shock. Now, septic and septic shock are very serious types of infections. So, any of the infections that are listed above, they may lead to sepsis. And sepsis is a clinical condition where there is not only infection, but there is a dysregulation of the immune response to the infection. So sepsis, please remember, is a very serious type of infection where there is not only infection must be there for sepsis, but not just any infection. It is an infection where there is a serious dysregulated immune response. Any infection will lead to an immune response. But when that immune response lacks regulation, lacks control, it becomes sepsis. And septic shock is a very severe type of sepsis which leads to high morbidity, high mortality, etc., etc. Next slide, please. So we need to also know what are the type of patients in which superbug infections are commonly found. Now there are, if we know the type of patients where superbug infections are found, probably we could focus our resources to prevent infections, to prevent superbug infections in those patients who are more vulnerable. So the most important type is the patients on frequent and prolonged use of broad spectrum antibiotics. So patients who are using antibiotics very often, very frequently, which are broad spectrum antibiotics, they are very prone to superbug infection. So we should be wary about using antibiotics. Hospitalized patients. So these are another group of patients who are very, very vulnerable to superbug infections. Then there are patients with frequent admission or visits to hospitals. Now, many patients, either because of hemodialysis or because of, let's say, cancer treatment, those patients who have chronic disorders, chronic health issues, be it heart disease, respiratory diseases, liver disease, kidney disease, neurological diseases, bone joint disease. So they may have to visit the hospital many, many times. And the more one visits the hospitals and more one gets antibiotic treatment, the greater the propensity to get superbug infections. It is not then surprising for cancer patients who are under treatment for weeks, months, and sometimes years to have superbug infections. There are also transplant patients like those with liver transplant, kidney transplant, etc., or bone marrow transplant, also known as hematopoietic stem cell transplant, to have superbug infections because they have to be very intensively associated with the healthcare setting. They often have immunosuppression, as a result of which they have infection. Because of infection, they are treated with antibiotics, and these antibiotics in turn lead to the generation of superbugs. And because of the frequent visit to healthcare settings, they also can get the superbug infections from an exogenous source. So please remember that superbug infections in a patient can have two sources. One is the endogenous source, where the bacteria present inside our body, they become resistant and they cause infections. And it could also have an exogenous source where the bacteria which are present in the external environment and already which has become resistant and become a superbug is entering into the body from some route, through some route. And the patients with medical devices such as catheters, IV lines, urinary catheters, they are also prone to develop superbug infections. Next slide, please. So the golden question is that we have known all these sort of things, all these dangers from superbug, but what can we do about it? So one of the big objectives of this presentation is to make the audience aware what are the ways to prevent superbug infections. So I have listed a few points which may help viewers and learned audience and science enthusiasts from developing strategies to prevent superbug infections. So number one is reduce use of broad spectrum antibiotics. If you have reduced use of antibiotics in the hospital, in the community, in the farm sector, there is a great possibility of reducing superbug infections. Maintain good hand hygiene. So washing of the hands with soap and water, and if that is not available, at least an alcohol-based hand sanitizer is very important to prevent patient-to-patient spread, staff-to-patient spread of superbug infections. Safe and appropriate segregation, disposal of management of biomedical waste. You know that the waste that is generated in healthcare facilities like hospitals, nursing homes, dispensaries, health centers, etc., they are by very nature different from the type of waste that we generate in the community, in our houses, in our homes. Because in the hospital, you're using many medical devices. Some of them are disposable, some are PPE, like personal protective equipments, and the patients are also vulnerable to many infections, including superbug infections. So these wastes are actually contaminated with many bacteria, many other pathogens, many germs, and many of them could be superbugs. So handling, that is a segregation, disposal, management of the biomedical waste in the healthcare facility is very important. Also, we must remember to use PPE appropriately. Now, in the COVID era, we have come to know about these superbugs, about the PPE, that is things like mask, gloves, cap, plastic apron, goggles, face shield, etc. Now, these are examples of PPE. Now, but please remember that the PPE is not just for COVID. Okay, PPE has been there for many reasons, for many years, and it is actually used in healthcare setting for a variety of reasons, sometimes to protect the patient, often to protect the staff, and quite on a number of times to do both. So we have to use the PPE appropriately. Environmental cleaning and disinfection is very important. We are now going through the Swachh Bharat campaign, Clean India campaign. It is an important initiative to actually clean up our communities, our hospitals, because unless we can maintain cleanliness, there must be safe injection practices. Whenever giving any intramuscular injection, intravenous injection, subcutaneous injection, either for vaccination or for other medicine delivery, a saline infusion, these have to be done under very aseptic precautions. Safe disposal and treatment of date-expired antibiotics or antibiotic waste from pharmaceutical factories. You know, we cannot throw our antibiotics into the garbage. Okay, we cannot recycle thrown medicines. They have to be disposed of appropriately as biomedical waste. Okay, the effluents from antibiotic pharmaceutical industry cannot go into the drain or cannot go into the river. So they have to be properly processed and then they should be discarded as waste. Appropriate use of antibiotics in veterinary medicine for animal health. This is another important measure which is important for the prevention of superbug infections. Slide, please. What can the general public do to reduce superbug infections in the community? Now, the general public, interestingly, can do a lot of things. See, the general is able to do anything without the help of the general public. All the specialty knowledge, all the scientific knowledge would go in vain if it cannot be adopted at the community level, if it cannot be implemented at the community level. So the general public has to be educated, has to be informed about scientific principles, about scientific practices, about standard operating procedures. So the general public can do a lot. So what can the general public do to reduce superbug infections in the community? Do not take antibiotics without the prescription of a registered medical practitioner. That's very, very important. We often go to the medicine shop and tell that I'm having fever or I'm having a sore throat. Can you suggest some antibiotics? Now that is a bad practice. Okay, because you are not a specialist. The pharmacist is also not a doctor. Okay, he may be giving it in good faith, but by doing so, he is actually not following the standard practice. Do not take the antibiotics beyond the prescribed number of days. Doctor writes the antibiotic for 5 days, we decide to take it for 7 days or 10 days. That's wrong. Do not use old prescriptions from a previous illness to buy or use antibiotics. Often happens, I had, let's say, an infection in January of 2020. I remember the signs and symptoms. I went to a doctor. The doctor gave me some antibiotics. I took the antibiotics and got better. Now, after that, what happened is that I have another infection in July, let's say, of the same year. And I think that the symptoms are very, very similar. And I should be using the same antibiotics. Now, I am not a doctor. Even if I am a doctor, I should not be treating myself. I should go to another doctor, take his or her advice, and then take the antibiotics if required, if prescribed, only according to the prescription. So do not use antibiotics for common uncomplicated illnesses such as mild fever, mild cold, mild cough, or allergy or diarrhea. There is a propensity in the community, somebody has 1 or 2 episodes of diarrhea and they start taking antibiotics. Now that is not right. The treatment of diarrhea is not necessarily antibiotics. Most diarrhea can be treated with oral rehydration solution, which is much cheaper, much effective, safer than any antibiotics to treat diarrhea. Do the essential things to avoid infections. Lead a healthy lifestyle. Have a healthy diet. Maintain hand hygiene. Maintain personal hygiene. Exercise regularly. Control comorbidities like diabetes and obesity. Reduce, control, and eliminate addiction like smoking and alcoholism. And take vaccines as recommended. If one is able to do all of these measures, they would be in a far better position actually to control infections and certainly drug-resistant superbug infections. Next slide, please. So what can the pharmacist who is selling drugs can do to control the superbugs? Please remember, do not sell antibiotics or antifungal agents without a valid prescription. So what is a valid prescription? A valid prescription is one where it is prescribed by a registered medical practitioner. Okay, see the doctor's name, doctor's qualification, doctor's registration number. It should be dated appropriately. You should not be prescribing an antibiotic which is dated in January and you're dispensing that antibiotic or selling that antibiotic in November or December. Do not do that. Do not sell antibiotics or antifungals beyond the specified number of dates. So the doctor may have said, take the antibiotics for 5 days, for which 10 tablets of antibiotics are enough. You go on selling 20 drugs. That's inappropriate. Okay, I can understand that you may not always like to sell medicines by cutting a strip. Do not do that. But do not make your best effort to sell what is essential. Store antibiotics at appropriate temperature and humidity conditions and transport them appropriately. Because unless you can safely store them, safely transport them, they would lose their efficacy. And so if they lose the efficacy and quality, then they would not be able to treat any infections. And that will lead to more drug-resistant infections. Next slide, please. So, the superbug infections in HIV/AIDS patients. Now, today is the World AIDS Day, and we know in India there are many cases of HIV infections. The total number is about 2.1 million or about 21 lakhs. Now, It sounds staggering. In terms of percentage, it will probably come about 0.2% because we have a large population. But don't underestimate, never underestimate HIV. If there is one lesson about HIV/AIDS, one has to take home on this World AIDS Day is never underestimate HIV/AIDS. And you know it can be sexually transmitted. HIV can be transmitted through unsafe use of intravenous drugs and intravenous needles and syringes. It can be transmitted from mother to children. It can be transmitted through blood and blood products. So take the appropriate precautions to prevent HIV/AIDS. So that's the important message on the World AIDS Day. AIDS patients are more vulnerable to superbug infections than HIV patients without AIDS. Please note that all patients with HIV, not all patients with HIV get AIDS. So there is a difference between getting HIV and getting AIDS. AIDS is a situation where an HIV patient has lost significant amount of his or her immunity because of an unregulated or unrestricted proliferation of the HIV virus, which has destroyed most of the immunological cells of the body. When that condition develops, where the body's immunity has been destroyed by the HIV, then one gets AIDS. And when one gets AIDS, they develop opportunistic infections or AIDS-related malignancies or cancers. In AIDS, immunity towards infection or cancers is severely compromised. AIDS patients are more likely to be admitted to hospital and have AIDS-related infections or malignancies, as I just described. And the progression from an HIV infection to AIDS can be delayed or stopped by taking antiretroviral treatment regularly as per the advice of HIV physicians. So that's the important message. So if one takes antiretroviral medications appropriately, one can prevent the progression from a HIV infection to that of AIDS. So next slide, please. Now, this is a sort of a blown up pie chart which shows the global impact of antimicrobial resistant or superbug infections. Now, you have currently, now this report is about 4 years old, and it was estimated in 2016, that is 4 years back, that currently 700,000 people or 7 lakh people die of antimicrobial resistant infections. I gave you the figure almost from the same time that every year about 60,000 neonates die of antibiotic resistant infections in India alone. Now, this is a global figure. 700,000 people die of antimicrobial resistant infections. But if we are unable to control it by 2015, so it estimated that in about 30 years' time, 10 million or 1 crore people may die from antibiotic resistant infections. Now, that's a lot of deaths. Okay, so it's a staggering amount of death, and how serious it is, if one just has a look at the other causes of death, it would be clear. Compared to that, cancer causes 8.2 million deaths, cholera about 100,000 deaths, diarrhea about 1.5 million deaths, diabetes about the same million deaths, 1.5, measles about 130,000 deaths, road traffic accidents about 1.2 million deaths, and tetanus about 60,000 deaths. So antimicrobial resistance may overtake all these other causes of death if we are unable to control it by a variety of different measures. Next slide, please. So this is an important report also which came out from a committee which was chaired by Jim O'Neill, and I would recommend those of you who are interested in this topic to actually go through this report. It is an 84-page document. It is freely available on the World Wide Web. So if you just Google it with the Jim O'Neill report on AMR or antimicrobial resistance, you will get this. And it gives the variety of different reasons and measures that can be taken to prevent and protect us from drug-resistant superbug infections. Next slide, please. Now, it has been observed that you cannot tackle antimicrobial resistant infections using a single tool or using a single approach. You should actually use a variety of different tools or approaches to tackle drug-resistant infections. So the Jim O'Neill report talks about 10 different fronts on which antimicrobial resistance or superbugs have to be fought. And this includes public awareness, and this meeting is aimed towards that. Antibiotics in agriculture and environment has to be reduced. Sanitation and hygiene have to be improved. Vaccines and alternative modes of treatment such as fast therapy, etc., have to be explored. Surveillance for antimicrobial resistance. That is, we should know almost on a real-time basis what is the magnitude of problem of antimicrobial resistance. We should know how many bloodstream infections or sepsis are caused by antimicrobial resistant superbugs. We should know how many urinary tract infections are caused by them. We should know how many surgical site infections are caused by them. We should know how many pneumonia are caused by antimicrobial resistant superbugs. So that is surveillance. And we need to put in place a surveillance system. We need to invest in human capital because we have to create experts. We have to create lab technologists. We have to create vaccine manufacturers for prevention of drug-resistant superbug infections. There has to be a global innovation fund because it is not cheap to develop new antibiotics, and sometimes they are not very profitable businesses. So there has to be an innovation fund to do that. There has to be development of rapid diagnostics because these infections have to be actually detected early to prevent morbidity and mortality. We have to have new drugs to treat these superbug infections, and there has to be international coalition for action. See, because it is a global problem affecting about 200 countries. So all countries have to work together to fight this menace. It spreads from people to people, from country to country, and it does not even leave the environment. So there has to be a global coalition to fight antimicrobial resistant superbugs. Next slide, please. Next slide, please.
Sir, it's there, it's done.
Next slide, please.
Sir, it's done. Could you see, sir, that slide?
I'm unable to see the next slide.
Unable to see? Are you able to see, sir?
No? Yes. I'm now able to see. Thank you.
No.
So the other strategy is lowering demand for antimicrobials and reducing unnecessary use is very, very important. So if you lower the demand for antimicrobial agents or antibiotics, if you reduce unnecessary use of antibiotics, your battle is half won. But for that, it is easy said than done. For that, you need to increase public awareness. You need to actually improve sanitation and hygiene. You need to reduce antibiotic use in agriculture and environment. You need to develop vaccines for preventable diseases to prevent super infections by superbugs. You need to develop rapid diagnostics, and you need to invest in human capital. All that has been said before, but I'm saying that once again to highlight its importance. Next slide, please. Another very simple but very important method is provision of safe, potable drinking water and washing water to people. See, if we have better water and sanitation facilities, it reduces antimicrobial consumption. So it has been shown in a study in 4 middle-income countries that introducing water and sanitation infrastructure could sustainably reduce the number of related diarrhea treated with antibiotics. So if you use better water quality, if you have better sanitation facility, it reduces the incidence of diarrheal diseases, and it also reduces the need for antibiotics. So it was found that 60% potential decrease in the number of cases of water and sanitation related diarrhea being treated with antibiotics. So if you do these things, improve sanitation and provide better water, 60% decrease in diarrheal diseases and diseases which need to be treated with antibiotics. Next slide, please. Now, antibiotics are also used in farm animals like cattle, cows, buffalo, sheep, etc. Sometimes they are used to treat infections in these animals. Sometimes they are also used to increase productivity as growth promoters. So the scientific evidence is such that most published papers provide evidence to support limiting use of antibiotics in agriculture. Okay, so here 114 studies supported limiting the use of antibiotics, and 100 academic papers support limiting use, and 15 against limiting use. So the evidence in favor of limiting antibiotics in agriculture is really overwhelming. There is practically no comparison. There is practically no doubt at the moment, as the scientific evidence stands, that if we reduce the use of antibiotics in agriculture, it helps in actually reducing superbugs in the community. Next slide, please. Increasing coverage of vaccines can reduce antibiotic use. Now, there are many vaccines, and unfortunately, although we have a very elaborate and in some places very robust childhood immunization services, it is not the case with adults. And also, there are many other infections which could be preventable with vaccines, as we are seeing with COVID vaccine, which is making so much of news. So there are many infections like pneumonia is a common bacterial infection for which there are very good vaccines currently available. There is influenza vaccine, for example. But majority of the population do not use these vaccines because either they are not in the national immunization program yet, or they are out of reach of the common people, or the public awareness has not been developed yet. There is lack of funding. All these reasons are there where vaccines are being suboptimally used. So if we use the vaccines properly, it has been shown there could be a 47% reduction of antibiotic use. So that's a remarkable figure, that appropriate use of vaccination can reduce antibiotic use. Next slide, please. So there is no doubt that better diagnostic technology, that is better laboratory tests and better treatment, could save numerous lives. So this was seen in case of TB. So if you have TB which has a better diagnostics, it has one type of curve in terms of saving lives. If you have TB where you have used better treatment modalities, your saving life situation improves. And last but not least, if you do both, that is smarter diagnostics and better treatment in terms of better observation, better supervision, better quality control of the drugs, and better diagnostics, you can save many more lives. And for TB, it was found that lives, about 770,000 lives, could be saved over the next 10 years by combining better diagnostics with better treatment. And that is true not just for TB. It is true for superbug infections as well. Next slide, please. Next slide, please. Yeah. So, to summarize, superbug infections is a global emergency. There is no doubt about that. Various learned authors, various scientific bodies, various organizations have warned that superbug infections is a global emergency, just like COVID, albeit in a much more slow pace than COVID, but it is actually picking up. And if not tackled, rising AMR or antimicrobial resistance could have a devastating impact. It has been estimated that if we are unable to stop the spread of superbugs by the year 2050, so that's only 30 years' time, the death toll could be a staggering one person dying every 3 seconds because of AMR or antimicrobial resistant infections. So the problem could be such that every 3 seconds, somebody somewhere in this globe, in this planet Earth, is dying because of drug-resistant infections unless it is tackled like an emergency, as we are doing in case of COVID. Now, these are all challenges, and one of the challenges is actually funding for the development of new tools, new techniques, new drugs, new public awareness campaigns for the prevention and treatment of superbug infections. Next slide, please. So this slide shows that what sort of investment is required. So estimated cost to be funded globally at a supranational level for 10 years to control superbug infections. So this cannot be achieved with a substantial investment in healthcare, in preventative health. So promote the development of new antimicrobials, including making better use of the existing ones. So that will cost over 10 years about $16 billion US. So promote development Global Innovation Fund supporting basic and non-commercial research in drugs, vaccines, and diagnostics. This will take another $2 billion. So to support the companies to develop these drugs, you need money because it may not be profit-making initially or directly. So that Global Innovation Fund would have to be funded by about $2 billion over the next 5 years. Rolling out existing and new diagnostics and vaccines. So there are certain tools like vaccines and diagnostic tests, laboratory tests, which are already there, but they are not accessible to majority of the general public. In order to make them accessible, you need another $1 to $2 billion per year for the next few years. And the global public awareness campaign. So public have to be informed, educated. New training has to be given to aspiring specialists. In order to do that, you need about $100 million US per year. So it looks like a lot of money, but in the grand scheme of things, when our existence is at stake, it is like a war effort. So as you spend money in the protection of the country, you have to spend money to prevent superbug infection. So that is the nature of the challenge facing us. Next slide, please. I would conclude by drawing your attention to these important references. The first web link is for the Jim O'Neill report. The next is from the ICMR's website about antimicrobial resistance surveillance network. The third is from the World Health Organization, followed by the one from Center for Disease Control and Prevention. And I must also thank the Science Museum to put up important and interesting messages for the general public about superbugs, about drug-resistant infections, and organizing lectures and demonstration sessions like the one that we are having now. And I would like to conclude my talk by acknowledging and saying thank you to to the National Council of Science Museum, the Birla Industrial and Technological Museum in Kolkata, Indian Council of Medical Research, and the Tata Medical Center in Kolkata, who has given us the platform to have this session today. Thank you very much, and I'm happy to take questions from the audience if there are any. Thank you.
Thank you very much, Doctor. It's been very informative, enriching talk, and you have presented such a lucid manner to address the major issues of the antimicrobial resistance. Hope our viewers must have definitely understood. So I'll be attending few of the questions from the visitors. May I attend, sir?
Yeah, Mr. Srinu, sir, if you could speak a bit loudly, because the audio, yeah, is of low volume.
Okay, sir, I would be speaking loudly. So can you
Okay.
hear me? Can you hear me?
Yeah, I can just about hear you.
Yes, sir, yes, sir. So I would be attending questions posted by the viewers. So first question is from Riddhi, and she wants to know who is most at risk for antibiotic resistance.
Okay, so the question, if I've understood correctly,
Who
Mr.
is-
Srinu, I hope I am audible to you
Yes,
and the audience.
you are very much audible, sir.
Okay, so as I have given you in a list in the slides, that the people who are most at risk are those who take antibiotics frequently, particularly broad spectrum antibiotics, those who visit hospitals and healthcare centers for a variety of reasons repeatedly, those who are immunosuppressed, like HIV, cancer patients, transplant patients, those who have medical devices like vascular catheters or intravenous lines or urinary catheters. So these are the people who are more prone to develop superbug infections. Of course, personal hygiene play a very important role. So if somebody is not maintaining a very hygienic practice, they are more prone to develop these superbug infections.
Thank you, sir. Achisman would like to know, can bacteria and virus develop resistance to vaccines?
Yeah, there is a phenomenon called vaccine non-response, but that is not exactly resistance. See, you will see that antibiotic resistance is not the same as vaccine non-response. So the public and the listeners should be very clear about that it is not that all vaccines will work, but vaccine non-response is an immunological phenomenon. Okay, it has not much to do with drugs. Whereas antibiotic resistance occurs, or superbugs infection occurs, because of exposure to antibiotics, antifungals, and other drugs. So the mechanism of vaccine non-response and antibiotic resistance is totally different, and they should not be mixed up and confused.
Okay, sir. Thank you, sir. Next one from Gargi. Is antibiotic resistance gene vary with the bacteria, or they remain same in different bacteria?
Yes, certainly. Actually, there is a genetic basis of antibiotic resistance. I have not gone into the details of the genetic basis of antibiotic resistance, because we wanted to make the topic and the presentation lucid and very clear for the general audience. But there are antibiotic resistance genes, and these antibiotic resistance genes are ultimately responsible for antibiotic resistance. So what happens when a bacteria is actually exposed to antibiotic? It may respond and get killed or inactivated, or it may develop a resistance. Now, when this resistance develops, generally a change in this genetic makeup also occurs. And these are known as antibiotic resistance genes. Now, these genes can transfer from one bacteria to another bacteria. And these genes can transfer from the mother bacteria to the daughter bacteria, or the father bacteria to the next generation of bacteria. Or they can transfer between two bacteria coexisting at the same time. So there could be a horizontal spread of the antibiotic resistance gene, or there could be a vertical spread of antibiotic resistance genes. So this is very much a reality and a topic of ongoing research.
Thank you, Doctor. Next one is from Pratya Sapal. Can antibiofilm be used to mitigate the widespread problem imposed by NMR strains?
I did not get the question very clearly. If you could repeat it.
Can antibiofilm be used to mitigate the widespread problem imposed by NMR strains?
The question is still not very clear, but what I have understood, that whether is sort of an antibiotic coated film could be used to prevent certain types of infections. Now, there are devices in the market which are antibiotic impregnated. As for example, antibiotic coated catheters are there, antibiotic coated urinary catheters, vascular catheters, antibiotic coated other medical devices do exist. Now, the problem is that they may be useful for drug sensitive infections, but obviously they are not much useful for drug resistant infections. So that's the problem.
Okay, sir. So next one is from Endrapalli. Some diseases are spreading before proper diagnosis. How can we control the deadly diseases in rural areas like India?
Yes. So that is why it is very true that it is not possible to get advanced technology at a very peripheral level, at a village level. So at that situation, there are certain things we have to do differently. As for example, sanitation, hygiene, safe potable drinking water, vaccination, awareness about the misuse of antibiotics. So these are the sort of educational interventions and lifestyle interventions and social interventions we have to introduce to tackle the problem of antibiotic resistance at the village level.
Thank you, sir. So we have done with the questions, sir. Now, I have a question for you, sir. Would like to know. Sir, this is ongoing COVID pandemic time, and whoever gets infected with the COVID, or he or she will have to stay in the hospital, or relatives of that patient will have to visit to the hospital. That means whenever people visit to the hospital, there is a chance of hospital acquired infection, as you have mentioned, the external environment. So in order to avoid this external environment, contraction, so people, what kind of general precautions they can take? Could you suggest us, sir?
Okay, thank you, Srindu sir, for your question. It is true that COVID patients can also get bacterial infections, and COVID patients certainly can get drug-resistant superbug infections. Now, the preventative techniques are no different, be it for COVID patients or be it for non-COVID patients. So the same principle of antimicrobial stewardship, which is safe, appropriate use of antibiotics in all sectors of healthcare, is true. Same principles of standard precautions, that is hand hygiene, appropriate use of PPE, appropriate use of disposal of biomedical waste, environmental cleaning and disinfection, safe injection practices, respiratory hygiene and cough etiquette. These are the pillars based on which antimicrobial resistance has to be tackled. Personal hygiene and environmental hygiene are very big factors in prevention of superbug infections. So, in COVID patients also, we should use antibiotics very judiciously. Be aware that COVID patients can get bacterial infections also. So, do appropriate tests if there is a suspicion, like culture, antibiotic sensitivity, etc., wherever it is indicated and prescribed by the doctor. Follow the doctor's prescription with regard to antibiotics and maintain a hygienic, healthy habit and practices, be it in the home, in the community, or in the healthcare settings.
Thank you, sir. Sir, another one, like there is a notion that human body becomes too resistant to antibiotics, but the fact is that it is bacteria which become resistant to the antibiotics. Like in any case, once antibiotic resistance is seen, then can it be reversed?
Well, it's an important and interesting question whether antibiotic resistance can be reversed. Now, it has been seen that if you do not use certain antibiotics for a significant period of time, the drug-resistant bacteria becomes less common, and over time, the drug-sensitive bacterial population increases. So, because the antibiotics, they exert what is called a selection pressure on the microbial environment. Now, if you take out that selection pressure, what happens? The drug-sensitive bacteria, and many of which are not harmful bacteria, they are helpful bacteria, they will have time to grow back, and they will become, they will overtake the population of the drug-resistant bacteria. So, in that sense, it is possible to see a situation where when you stop the use of a particular antibiotics, after a few years, you may see that the patients that are coming to the hospital are sensitive to a particular antibiotic which you have stopped using. So this is a phenomenon which is well recognized in medical practice.
Thank you, doctor. Sir, I am done. One more question is there from the participant. If you allow me, I will take. Shall I take, sir?
Yes, please. Yes, please.
Yes. Another question is from the same, the Pratyasa. She would like to know, can hypothetical proteins be used as a potential vehicles for developing drugs against superbugs?
Yes, there are research which is underway to identify proteins produced by not only these are either natural proteins such as enzymes, or they are derived from bacteriophages, which are viruses, or from other living cells, that they have a action. They have an action against certain bacteria. So it is a matter of intense scientific research at the moment, whether you can use proteins from a variety of different sources to act as drugs to treat drug-resistant infections, including superbug infections.
Thank you, doctor. So questions are done, Dr. Bhattacharya. So we have come to the conclusion session. We thank you very much, Dr. Bhattacharya, for taking a time out from your very busy schedule and joining us today to address the AMR related issue. We express our sincere gratitude to you, and we look forward to have you with us in future events as well, in similar kind of programs. And we thank you very much for joining us. Despite you are very busy just before the session begins, but still somehow managed to join. We are very much thankful to you, Doctor.
Thank you, sir, for the wonderful opportunity. And I am grateful to this platform given to spread public awareness about antimicrobial resistance and superbugs. Thank you.
Thank you, sir. We thank you all the viewers for joining us this afternoon, and not only joining and throughout active participation. We are coming up with one more lecture next week on 10th on the topic Nobel Prize in Chemistry for 2020. We invite you all to join in that lecture session as well. So in this lecture session as well. Do till the time and take care. Bye.